Hi, everybody. My name is Becky, and I'm a current PhD student in the Health Behavior Research program here. And this is what I'm going to present to you today. It's actually a project that I led when I was working on the Healing Communities study right before coming here. And before I get started, I just want to acknowledge that we're going to talk about overdose death in this presentation. And while the data are presented as rates here, they are lives that are lost, that were loved, and deserve to be treated with respect rather than just analyzed as statistics. So with that, we're going to get started. So currently we know there's racial inequities in rates of fatal overdose, both nationwide and at state levels. Rates among Black and Hispanic residents in Massachusetts more than doubled from 2015 to 2022, while they stayed similar among white residents. We also must acknowledge the impact of structural racism to further inform our understanding of these inequities and improve public health initiatives in a more equitable way. And we define structural racism as the totality of ways in which societies foster racial discrimination through mutually reinforcing systems of housing, education, employment, and so on. These reinforcing systems result in the development of state-sanctioned policies, some of the most apparent of which are historic land use and housing policies. So an example of one of these policies is historic redlining, which was conducted in the 1930s when the Homeowners Loan Corporation, or the HOLC, a US government agency, appraised and graded city neighborhoods nationwide based on the race, class, and immigration status of residents. Banks were advised not to offer mortgage loans to residents of lower graded neighborhoods, which in this presentation we're defining as those graded declining or hazardous. And in this, we're one step behind on my slide, sorry. In this picture here, you can see the different colors. So the lower graded neighborhoods, the lowest is color-coded in red. That's considered hazardous by the HOLC. Yellow is considered declining. Blue is considered still desirable, or green is best. Green is where it was all white residents. Red is where there were any Black or immigrant residents residing. Sorry to get off track there. So the banks were advised to not offer mortgage loans to those residents of lower graded neighborhoods. And in turn, this denied home ownership and encouraged the maintenance of racial segregation. And this may have led to neighborhood conditions that increase adverse health outcomes today. And there are a few existing studies that found historical redlining to be associated with current health outcomes, but to our knowledge, there are no studies that have examined the association with opioid overdose deaths. So with that, it led us to our research question. Are there differences between mean 2015 to 2019 opioid-related overdose death rates by historical redlining grade? Best versus still desirable versus declining versus hazardous within Massachusetts census tracts, both among the total population and by race and ethnicity. So in order to answer our research question, we use the following methods. First, we translated the whole grades to 2010 census tracts via a weighting method that utilized proportions of total census tract land area graded, and only census tracts that had greater than 50% of their land area graded were included in our analyses. Second, we matched the translated census tract grades to 2015 to 2019 rates of fatal opioid overdose and census tract population characteristics. And finally, we conducted analysis of variance, or ANOVA tests, to compare the mean 5-year average rates of fatal opioid overdose by translated redlining grades. So we found that 326 census tracts in Massachusetts were eligible to be included in our study and received a translated redlining grade, and over 1,800 opioid overdose deaths occurred to residents of those census tracts. Here you can see that declining in yellow on the pie graph was the translated grade that was most frequently received, while only about 9% of census tracts received the grade of best in green. But there were similar proportions of census tracts that received the grade still desirable in blue or hazardous in red. Residents of census tracts who were graded declining or hazardous had significantly higher proportions of younger residents, residents who identified as Hispanic or Black, residents with a high school education or less, and residents living below the poverty line. And just over 90% of the census tracts included in our study had at least one opioid overdose death occur from 2015 to 2019, and the average 5-year annual rate was just over 33 deaths per 100,000 residents. So on this bar graph, I'm going to compare the mean 5-year annual census tract rates of fatal overdose by translated redlining grade. And overall, you can see that rates increased across census tract grades from best through hazardous. And census tracts graded hazardous had a mean rate of over 2-fold greater than those graded best. These trends were similar among white and Hispanic residents after stratifying by race ethnicity, and the mean rate among Hispanic residents of hazardous census tracts was 4 times greater than those living in best, and similarly among white residents living in hazardous census tracts, it was 2 times greater than those living in best. Interestingly, we did not see the same trend occur among Black residents, and while fatal opioid overdose rates were especially low in census tracts graded best and highest in still desirable, there was no significant difference detected. It's important to note here that 67% of the census tracts included in our study did not have any opioid overdose deaths occur among Black residents, and those that did have at least one death among a Black person, the range of fatal overdose rates was very large. So with that, our findings are consistent with other studies conducted in Massachusetts and suggest that a system based on racial segregation can have long-term negative impacts across racial and ethnic groups. Our study does have limitations. Our results are limited for Black residents and does not include other historically minoritized groups also experiencing inequitable rates of overdose, particularly American Indian residents. Additionally, our study does not estimate a measure of effect or account for other social factors and structurally racist policies that influence neighborhood outcomes today. But despite these limitations, our results provide a starting point for further examination of structural racism's impact on opioid overdose outcomes, further multi-level modeling and mediation analyses may support the implementation of interventions designed to help redress the impacts of structural racism. Thank you.